Good afternoon, everybody. My name is Mercedes Smith. I am a student at Taylor College, hoping to graduate this August, summer 2020. Today I'm going to be discussing with you a rare disease called Klüver-Bucy Syndrome. You're probably asking yourself, what is Klüver-Bucy Syndrome? Well, I happen to know that it's a rare impairment that was discovered in 1930 by Hoover and Bucy, in which both temporal lobes are damaged, causing abnormalities in memory. It is characterized by inappropriate sexual behaviors and mouthing of the objects. Signs and symptoms, ways you can recognize someone with this disease. You can see diminished ability to visually recognize objects. You can see loss of fear, loss of anger responses, memory loss, distractibility, seizures, dementia, hyperphagia, hyperorality, hypersexuality. What causes this disease? A lot of the times we get diseases and we want to know, well, where does this come from? How do we get this? It is caused by herpes simplex encephalitis. Particularly, this affects the temporal lobes. It can be caused by trauma, stroke, Alzheimer's, Niemann Pick disease, and for those of you who are questioning what's that, it's a metabolic condition that affects various organs. And it can also be caused by bilateral lesions to both temporal lobes. Diagnostics. Ways to be diagnosed with this disease, you could basically be confirmed by an MRI, or you can notice someone having classic symptoms. Ways to treat this disease. Carbamazepine may be given to treat the hypersexuality, but you will want to treat this patient symptomatic and supportive, and drug therapy may be included. You will want to assist them with ADLs, occupational therapy, and you may also want to include SSRIs. With treatment, symptoms may slowly decline. You probably want to know, well, is there a cure for this type of disorder? Or with me taking meds, will that help? Sadly, there's no cure for the Klüver-Bucy Syndrome. Although this disorder is not life-threatening, dealing with patients with this disorder can sometimes be difficult to manage. You can watch videos on YouTube. You can use informative essays on this disease. But today, I'm teaching you what I've learned. Hopefully, this was enough for you. And thank you guys for joining.